A patient was being discharged. As she went to sit in a wheelchair, it was not fully opened. She placed both of her hands on the seat. When she sat down, the chair snapped into place, partially amputating her right pinky finger. Wheelchairs are one of the most common assistive devices used in healthcare facilities, but not knowing how to use them can cause a catastrophic injury to patients, visitors, volunteers, or staff. Wheelchairs are often found at hospital entrances for patients or visitors with mobility issues. Hospital volunteers, transport staff, and clinical staff use wheelchairs to move patients to different care areas for testing or treatment. When patients are discharged, many hospitals require they be transported to the exit in a wheelchair. Wheelchairs may seem simple and straightforward to operate. However, not knowing the proper way to unfold a wheelchair or where to place your hands when sitting in one can cause finger injuries such as cuts, bone fractures, and even amputation. The U.S. Food and Drug Administration's MAUD system for reporting safety incidents related to medical devices shows hundreds of wheelchair injuries since 2012. These involved various wheelchair types and injuries, including head injuries from tipping the wheelchair over, as well as finger injuries, ranging in severity from abrasions to amputations. The types of finger injuries identified in these event reports include cuts, loss of nails, broken bones, crushing injury, and loss of one or more fingers. What causes these types of trauma? Wheelchairs are often stored folded, and some reports describe the person who received the injury placing their hand on the seat to open the wheelchair. Fingers can be caught in the frame or hardware, on the side, or beneath the seat when it snaps into place. Reports also describe the user attempting to sit in a wheelchair when the seat is not fully engaged, whether by accident or an attempt to unfold the seat, and catching their finger between the seat and the side panel or armrest, or between the seat and the frame on the bottom of the wheelchair. How can we prevent finger injuries? There are different types of wheelchairs, such as manual, bariatric, transport, and motorized, from many manufacturers, so refer to the user's manual for safety instructions unique to your specific model. Some manuals caution about the risk of hand or pinching injuries from not unfolding the wheelchair or sitting in the wheelchair as directed. If the manual includes stickers warning users to keep hands clear when unfolding the chair, they should be attached to the wheelchair arms. Before purchasing a wheelchair, research the product thoroughly and review the MAUD database for any reports of adverse events related to the product. Request the trial from the distributor if possible. Facilities should review the owner's manual for information on how to safely operate the wheelchair. If you purchase a used wheelchair or a wheelchair from a third party, be sure to get instructions for using it. Although operating a wheelchair may not seem difficult, since severe injuries can occur, healthcare workers must receive education and training prior to using a wheelchair to transport patients, as they would before using any other medical equipment such as an IV pump. They should always fully engage the seat before allowing a patient to sit in the wheelchair. If wheelchairs are stored at the facility's entrance and staff cannot supervise their use by patients or visitors, consider replacing folding wheelchairs with rigid frame wheelchairs that cannot be folded. If available, use an anti-fold device. Follow the manufacturer's recommendations on routine inspection and maintenance. It is important that anyone using equipment understand and follow the manufacturer's instructions for use, regardless of how complex or simple the equipment may seem. They should also be aware of the risk involved with improper use to prevent injury from occurring and to keep patients, visitors, and staff safe.